Today we're going to talk about the aspect of cavitation in shockwave therapy. Cavitation is the most important aspect of a shockwave device, and that is what actually occurs within the tissues you're treating. This is particularly important when choosing a device, as without this internal cavitation phenomenon, shockwaves aren't actually produced, and the tissue healing responses of the body won't be stimulated. The key is, what is cavitation? This is the process of vapor bubble formation and subsequent collapse that occurs within the tissues where shockwave therapy is being applied. Sudden changes in pressure locally cause the formation of vapor bubbles within tissues. These bubbles then implode and create a microjet and shockwave, which in turn creates very focused and controlled local damage. These bubbles are created similar to when a boat's propeller chops through water. These bubbles aren't actually trapped in the water to start off with. Initially, it's changes in pressure between the front and the back of the blades as they move through the water. Then, as the bubbles move away from the propellers into an area of increased water pressure, the bubbles collapse, implode, that microjet is formed, and the subsequent shockwave is created. A shockwave applicator works in a similar fashion. When placed in water, you can actually see this sudden and repetitive change in pressure actually taking place within the water. And this is what differentiates one shockwave device from another. Cheaper models, although feeling equally as powerful to a device such as the Gymna, this cavitation production may not occur, in turn not creating the shockwaves required for treatment. The Gymna actually produces the ideal acoustic wave to create those cavitations we talked about earlier. And that's what's actually happening inside of tissues to create that local damage to encourage that change from the body.